How do you know if your back pain is serious? My name is Simon from Hogan and Mitchell, and in this video I'm going to be answering that question for you. Check it out. So how do you know if your back pain is serious? Well, there's a few things to look out for, and if you do have any of them, you definitely need to head straight to the emergency department. So the first thing to look out for is, was your back pain brought on by a traumatic event? Now what I'm talking about is a fall from a height, you came off a motorcycle, a severe car accident, you fell off a ladder from a height, and all of those things may indicate that you have a fracture within your spine. There are two reasons why someone might get a fracture. The first is someone with regular bone density, and they have a high force event which leads to a fracture within the bone. So those are some of the things that I've just described. The other group of people is someone who has osteoporosis, which is a reduction in the density of the bone, and they have something occur to them which might not be an enormous force, but it might be big enough for them to have a fracture. So if you're in either of those two groups and you've had a traumatic event leading to severe back pain, head straight to the emergency department. So the second thing to look out for is a sign of an infection. And the first sign of that is if you have a temperature. So if you have brand new back pain and you have an infection and it persists and you have a temperature above 38 degrees, it could be a sign of an infection. You can get things such as sepsis, you can get something called discitis. They're both things which need to be looked at urgently. So if you are thinking or if you're not sure, speak to a doctor as soon as possible and maybe head to the emergency department. The third thing to look out for is something called Calaquina Syndrome. Now we covered this in another video, so I'm going to put the link down below, so just check that out. But it's signs where you have symptoms of alteration, new changes in your bladder or your bowel function, an inability to control the muscles, emptying your bladder or your bowels, and sometimes along with those symptoms, a separate thing to look out for is where you have symptoms in both of your limbs, so in both legs. So if you have brand new symptoms on both limbs, that is definitely something that needs to be explored as to why you have that. It might not be a medical emergency, but if they have a combination of factors of the Calaquina syndrome and brand new leg pains, go get it checked out straight away. Now what's really important to say is that only a tiny percentage of all people with back pain, so less than 1%, will have it due to a serious problem. But it does happen. And if you have any of these things, it is regarded as a medical problem. It's not something you need to see a physio or an osteopath or a chiropractor for. You need to go and see a medical doctor. So I hope you found this video useful. If you have, like or comment below, ask us any questions and we'll get back to you. And just before you leave, click the subscribe button over here. Thanks for watching. I'll see you soon.